Another specialist team from Taiwan Taishan Veteran Hospital are on island for the past few weeks, meeting with patients diagnosed with bone, ENT and eye problem. During their stay, they have managed to meet more than 100 patients. Before they depart, Nauru reporter Chronisa Manu spoke with the three doctors and asked them more about their work.
We're here to try to offer our subspecial medical or surgical treatment for Nauru people. Yeah, these are our main purposes.
I understand all three specialize in different area. Tell us about your specialty.
My name is Pan Jianzhou. I come from Taichung General Veteran Hospital. I'm a bone surgery. I'm an orthopedic surgery. And in my left-hand side, Dr. Lin. Can you introduce yourself?
My name is Lin Wenjun, and also from Taichung Veteran General Hospital. And my specialty is ENT doctor.
My name is Li Shaorong. I'm come from the Kaohsiung Veteran General Hospital, and eye surgery is my specialist. And I do the cataract surgeries here.
我是刘美玲 I'm a nurse, assistant for eye doctor operation.
How many patients did you manage to meet during your short stay?
So in the bone orthopedic clinic, there are total 76 patients in orthopedic clinic, and for surgery and special treatment, there are total 4 patients. So this is the condition of bone clinic. And for ENT, in clinic there are total 60 patients, and 2 patients for surgery and special treatment. And for eye clinic, there are 110 patients was diagnosed and treated at clinic, and there are 22 patients received surgery and special treatment. So the total, there are 274 patients we have treated.
During a treatment, are there any special cases?
I can talk about the bone disease for patients. So most of the patients come to clinic, they suffer from the osteoarthritis, especially of the knee. They are the degenerative disease. And the second one is arthritis of spine, such as herniated disc. And there are some people have a traffic accident and fracture or dislocation of bone and joint. And how about the ENT condition?
In ENT field, I think the most common disease here is allergic rhinitis or with the chronic hypertrophic rhinitis because of the dust is everywhere. And the second is the chronic otitis media of the small child because they always have discharge from their ears and they always go to swimming. So the infection is very hard to control. And I also made some cleft palate or cleft children. So because it's difficult to surgery here, so I think it's a chance to refer to overseas for their operation.
As in my eye clinic, the cataract is the most case in my clinic. Also, the second is the diabetic retinopathy, and the third would be the complicated cataract, such as the uveitic case and the traumatic case. And most of the complicated case, it would be the tractional retinal detachment, and it is based on the diabetic retinopathy. And if the patient didn't control the sugar well, and they will develop the tractional retinal detachment, and it takes away the vision from the patient. And those patients should be seek the overseas treatment and for the tractional retinal detachment surgery.
What's your advice to the locals concerning a good health?
For bone condition, for bone disease, my recommendation is weight control. You know, for degenerative disease, most of them because of overweight. So the weight or degenerative disease become very, very common. And also my recommendation is the diet control, because maybe most people eat a lot of meat, but they need more and more vegetable and fruit. So how about for ENT?
In ENT field, I think because many children have chronic infection of their ear, so I suggest that if parents notice that their children have discharge from their ears, maybe they should take their children to hospital first for drug. And it's very important to avoid water of both ears till the discharge disappeared. It is the way to control the infection. Yes.
There is two major issues in the eye clinic, and the first one is the sugar control. Once the sugar control is getting worse, and the diabetic retinopathy is developed. And the second is the sunlight exposure, because the UV light causes the cataract progression, and it is quite common here. And the people here should wear sunglasses to protect their eyes and control their sugar to prevent the diabetic retinopathy. And that's my opinion.